as the district attorney mentioned, most folks at that time were really dropping off their meds because they were concerned more about the water system and about what might happen if they flushed their medications. But as the opiate epidemic took hold, folks really understood better, and our community members certainly understood. And so you can see the trajectory that we have from 2010 to 2016 in the volume of medications that are collected, in large part due to the district attorney's office and the high profile that you've given to this effort, which really keeps us at number one. Is our Bucks County residents prescribed more than other counties? Probably not. But do we all understand differently and better that it's so important to drop off the medications? Absolutely. So thanks to each and every one of you. Again, we couldn't do this without law enforcement and without you as community members, because on the medication take-back day, on October 28th, we have 51 drop sites. That means we need 51 law enforcement officers and 51 volunteers, and a lot of volunteers do just an hour or two, so it could be up to 200 volunteers. So thanks to every one of you who helps us with that project.
So addressing the heroin opioid epidemic is a multi-pronged approach, and recently the DA's office, in conjunction with Bucks County Drug and Alcohol 2, has unveiled about half a dozen different types of programs to address this in all different ways, from recovery to law enforcement. So just going down the list, Matt, if you want to just give a minute or two speech on what each of them do, starting with BPAIR, or Bucks County Assisting in Recovery Program.
Absolutely. This was a program that was started, I think, in Gloucester, Massachusetts, and Ben Salem, who often pilots a lot of our progressive programs, said, you know what, we're going to try this. And of course, I had to agree and to buy in, let them try it out. But the essence of it is, if a person is suffering from addiction, even if they possess drugs or drug paraphernalia, as long as they don't have a warrant out for their arrest and they haven't committed a new crime, they can voluntarily turn themselves in to the police station, certainly at Ben Salem, now at Warrington, and we're in the midst of applying for a grant, which would make it a lot easier for us to honor our commitment to make this county-wide. But we're going to do it whether we get the grant or not. We hope to have every police agency engaged in this, and the essence of it is, if you turn yourself in, or if a loved one turns you in and just says, I surrender, I need help, please don't lock me up, I need help, that they will then engage mobily. They'll get you a navigator, somebody who is familiar with this system, that will make sure that you get to an assessment site, and that can be 24 hours a day. You'll get that assessment, and the hope is that if you need a bed right then and there, it's not foolproof, but the hope is that you will get that treatment directly and immediately. And I think that's just shows you part of that police-public partnership. Unfortunately, well, we in law enforcement would love to stop the problem before it starts, but we can't always count on that. That doesn't always happen. That's just not reality. So many times people that suffer from addiction commit crimes. That's just the nature of the cycle. And one of the things that I have committed to, that I'm sworn to do, is to protect the public. We can't let people run amok. But we really are not trying to stop. We're not trying to prosecute the end user, so to speak. We do it because it's the law. What we are trying to do is we're trying to move up that chain. If we have to prosecute a drug sharer, we will, certainly. If we have to prosecute that drug dealer on the corner, we will, certainly. But I was able to, with the county's assistance, because they had to agree to give me the funding, to start a 6-person, 6-detective drug strike force. We actually grabbed one of the guys from Quakertown PD, who now serves on our 6-member strike force, and they do nothing but respond to high-level drug organizations to try to take them down. I want to cut the heads off of these snakes so that they can't harm our kids ever again. One last thing that we've done, I'm starting to see the signs up here a little bit, is called the Push Out the Pusher program. This is something that was actually brought to me by Representative John Galloway, who's down in the Falls area. And he saw that it was successful in another county, and he asked me if I would collaborate with him. And I said, sure, and the essence of it is this. We all know, we've talked about it now, we all know that there is drug dealing going on in our neighborhoods and in our towns. It's unfortunate, but that's the reality. So we wanted to empower people, encourage people to call the police, to call law enforcement. If you see something, say something. If you suspect something, give us a call. And you can get these signs. They're called Push Out the Pusher. And the essence of it is you put a sign on your lawn, hopefully your neighbor will put a sign on their lawn, and so on and so on. And what it shows, I think, it shows the neighborhood, it shows your neighbors that we're all in this together. There's 700 police in Bucks County. There's 625,000 of you in Bucks County. I'm deputizing all of you. I need your help. And if you want to get one of these signs, you can go online at buckscrimestoppers.org or .com. Please just Google it. That's what I do. And it will get you to where you can order a sign. And then if you have the sign or if you make that report, and that enables us to not only lock up a drug dealer, but to make a conviction, you can actually get paid for your tip, up to $5,000. Now, it's been my experience, most people aren't doing this for the money. They're doing it because we live in a neighborhood, we live in a community, and we want the community to be safe. So I encourage you to do those things and help us make this community the best that it can be.
Just back to the B-Pair program, I just wanted to point out that that was a program, or that was a need, really, that Dan and I had learned about from participating in these panel discussions. And we went back to our organization, Bucks County Association of Township Officials, after having attended a Bucks County Police Chiefs meeting, and saw that they were putting in for the grant. And we wanted to make sure, because it was such a valuable tool in this epidemic, that we wanted to make sure that our communities, our municipalities supported that program, and Bocado put in a letter of support for that grant that was applied for through the county DA's office. Do you want to add anything more to that?
Well, I think more importantly, you're hearing a lot of things here tonight. You're hearing what your school district's doing that's helping. You're hearing what law enforcement is doing, which is very helpful. You're hearing what Bucks Drug and Alcohol does that's also helpful. But I think more importantly, in my opinion, if I'm sitting in that audience, I want you to think about what you can do yourself. So I'm going to take it back into time. So 20 years ago, cigarette smoking was a really big deal, right? It was everywhere. Anywhere you went, there was cigarette smoking. Today, it's rare to see it. Now, there is some uptick with nicotine use, but in general, it's nowhere near where it was. And I think that if you turn your television on, besides a car commercial, what's the other commercial you always see? Pharmaceuticals, right? Every morning, every night, every afternoon is a pharmaceutical company giving a commercial about the latest drug they've got available. Many people in society think that pharmaceutical manufacturers are our friends, and they're not, folks. They're in the business to make money. There are some really great companies with really great drugs to help us. But what has happened is that we as a society have become a pill society. How many of us go to our doctors and request a specific drug? Well, that wasn't going on 20, 30, 40 years ago. That's marketing. We are aware of these drugs today. Maybe in some cases we're right, in other cases we're wrong. What I want you to think about is, how many pills do you really have at home that you don't need, as Matt has talked about with the drug give back? But also, what can you do from a societal standpoint to change this movement that is moving us towards a pharmaceutical type environment? Because if it's opiates today, it's going to be something else. We as a species are known to abuse substance. You can look at our history going way back to whenever. There's always been some form of abuse. Until we deal with that abuse, we are going to be constantly dealing with some form of it. And I think thinking about what we're doing as a species could potentially change the future with our offspring or their offspring. So I hope that does make a little bit of sense. Way off the base what you were talking about, I apologize.
That's okay. Appreciate your comments. Before we head into the question and answer portion of tonight's discussion, I just wanted to go down the panel and have everybody share their last minute thoughts or make some closing remarks. Starting with you, Dr. Yarnell.
I think tonight has been instructive to me. I heard Mr. Radigan say that 1 in 12 of us has had direct contact with someone that has been involved in the opioid heroin type of use. I have had that experience, not with family, but with a relative of family, not my family, but a relative by marriage. And it was a terrible situation. So I think it's worth thinking about that and looking for the signs of that. I want to note also that the board, it tries to be very supportive of the district and of the police, of course, who help us out numerous times, probably too numerous. They probably feel that way. But I think that's an important cooperation that I'd like to say the board appreciates the administration and the police effort to try to combat the problems that arise from, among other things, the drug issues. And the board has to look at this from a policy perspective. This is Cullen, who's out in the audience. One of my colleagues and I are going to attend the Pennridge School Boards Association convention that occurs in Hershey every October. And one of the topics there, of course, is the opioid addiction and crisis. So I'm very interested. I assume Mrs. Cullen is, and I don't want to put words in her mouth, but I assume she too is in hearing what other school districts are doing and the recommendations of any experts who happen to be there. It's certainly something that I can benefit from learning more about in the actions that we have to take as a board.
I'm sure that'll be very interesting. We have our annual convention too. We're in the spring, and again, that was an issue that was brought up as well for different reasons. So it's good that all this information is being shared with colleagues, whether it's school boards, township officials, and so forth. Dr. Radigan?
I'd just like to say again, I think if you live in this community, you are very fortunate because we truly have a team effort going. Whether it's our township officials, our police departments, the district attorney's office, the school board, the outside agencies, the help is here. Don't be ashamed to ask for help. It doesn't have to be for your own child. It could be for a nephew, a neighbor. If you just see something happening, we want to help. We're here to help, and we do have those resources for you.
Dan?
I'm not going to be as heavy this time. 4.5 years ago, I had the opportunity to come up here with Jacqueline and go to one of your football games. I have to tell you that your community is something really special. Like we said earlier, we did a lot of these roundtables. We have never seen a turnout like this. This is indicative of what your area is. These are people that care. I just had to thank you because it's impressive the interest that you people have and the quality of the environment that you have. Keep it up because it is something quite special.
Matt?
I think you've gotten some, an idea of the scope of the issue and what we all are doing about it, and hopefully you feel empowered to do something. You had some very practical tips of things that you can do to make a difference in this battle that we're facing. But I want to leave you with one more tip, and this is something that I practice what I preach on, and that is every time that I come to one of these or I give a talk, and plenty of times when I don't, I go home and I talk to my kids about it. Because that constant reinforcement, not the nagging, just to say, hey, we're out there, we're talking, we're having that conversation, and we talk about, like Steve said, positive reinforcement. Be in your kids' lives. You all wouldn't be here if you weren't in your kids' lives. And it's okay to be a little nosy and to make sure that you know what's going on and to make sure that they know that you care, even if they think you're obnoxious and insufferable. It is okay to be that way because frankly, they're our most precious resource. We got to keep them around so they can take care of us, frankly, when that's my last piece of advice.
Diane?
So the district attorney demonstrated the effective and quick and simple use of Narcan, but as he mentioned, it is simply a tool. It's a necessary tool. But the next step is the slide that you see behind us, and that is a new program that we've developed called BCARES. We do love our acronyms. So this is Bucks County Connect, Assist, Refer, Educate, and Support. It's a program for people who have survived overdose. So you have probably wondered what happens after an overdose. As long as the individual is willing to go to a hospital, then we are providing services for those folks, and those are certified recovery specialists. We know that people who have lived experience can be the most impactful in helping people who are struggling with their addictions. So very soon, all of the Bucks County hospitals will have the BCARES program. We're funding one agency in this community, and that's Penn Foundation, who is launching their program with Grandview Hospital, I understand, in the next week. Good luck to you. And then St. Luke's will be joining shortly. So we're really excited about the program. What will happen is that the individual will find themselves after the overdose at the emergency department. A certified recovery specialist will be dispatched to the emergency department to meet with that individual who survived overdose, to explain to them that the next step is treatment, as if they'd had cardiac arrest or some other medical procedure. The next step will be treatment. Have a choice, and we have to honor and respect that, but we want to be able to offer the next step in recovery to people who've survived overdose. So Narcan, extremely important, but we're taking it to the next step, which is called a warm handoff, which is now mandated in all of Pennsylvania.
Thank you. Chief?
I guess in closing, I would reiterate some of the same things that I said earlier. Ideally, it's best to prevent addiction from visiting your family or your loved ones. So you take the steps. Be strong enough to take action, starting tonight, to take those steps, to have those conversations, to be present in the lives of your loved ones. If addiction or signs of addiction do visit your family, be strong enough, be bold enough to take action to get them into treatment. As I said earlier, they're not going to get better on their own. There's not something you can just ignore and wait 3 weeks and hope it goes away. It's not going to. You've got to take action. So you take all those steps to prevent it from visiting you. If it does, take action to combat it. Take a deep breath, calm, and step forward into the problem. Thank you.
I think one thing everybody can walk away with tonight is knowing that there's a community of people to support you and that care and that can help you. Lots of resources here, and we really are fortunate for that. As I mentioned earlier, there's a mom here who wanted to say a few words before we start the question and answer period, and her name is Tracy Candro. If you'd like to.
I just wanted to say I'm very proud of Pennridge for doing this. And my son graduated here, his name is Jared.
Come over to
Sure. So I'm very proud that you guys are doing this. I think we needed it for a while, and it really, and I have a 14-year-old entering high school, so last year when my son passed away, I said, why am I here? I lost him. And then I thought, you know what, I have another one, and I don't want any other mother to go through this. And what the chief said is just, you really got to watch your kids. You got to watch their friends. And just, it takes a village. And know where your kids are hanging out. To drink, but you make bad decisions, let's face it. And I've talked to a lot of their friends, and when they're drinking, that's when they take the pills because they're not right. So we just really need to watch just everything you said, really, and I feel like I made a lot of those mistakes. I just was clueless. Oh, he's gonna drink, he's gonna smoke pot, he's a kid, and it's not like that anymore. And the drugs now are different than what they were when we were growing up. That's the bottom line. Heroin on, you know, Kensington, when I was growing up, I thought it was in Kensington with a needle in your arm. That's not the case. And a lot of them lived. You're not seeing people who are very in recovery anymore because they're dying. It takes that much. stop it before they even try it, because what you said, it doesn't, they don't have a choice and it will not go away. They will die. And I hate to say it, but they will die. So that's the harsh reality. And I was probably ashamed and afraid, and I didn't know what to do, and I cried alone. But there are so many resources, and just use them, and do not be afraid or embarrassed with the stigma. Just don't be embarrassed. And even if another child you see, reach out and help, and we all need to stand together for our kids coming into this high school. Don't even start it. Don't even put it in your mouth. And this is how they start as a little boy. All of us have little kids that start, they don't want to end up using heroin or drug stuff. Let's just try before they start. Prevention, I think. Everything you guys said was so good, and thank you, Pennridge. I'm a proud parent.
So Tracy, thank you so much, and I'm sure everybody's ready, but let's give Tracy a hand for her courage.
Thank you, Tracy. As a mom, your words meant more than everything that was said tonight. I just can't tell you how that has impacted me. It needs to be said. So with that, if there's anybody else who has a question or a comment, please stand up. Sure.
Hi, can you hear me? Great. My name is Bruce Richmond. I have an office in Sellersville. And for the last number of years, I've been treating opiate-dependent patients. I think there's some moving parts that are really helpful to understand. This has been a stellar lecture. I just got so much out of it. It was great. This was a stellar lecture. I got a lot out of it. Again, I'm Bruce Richmond. I'm a physician in Sellersville, and I treat opiate-dependent patients. It has become kind of my passion. I never met an addicted person who got up one morning and said, I'm going to become a heroin addict. What we know is that individuals self-treat undiagnosed psychiatric problems, and all kinds of, we call them adverse life events, and just not feeling well. And what happens is, we think the gateway drug, now, all this information is actually verified from hundreds of patients I've seen, so if it sounds crazy, I'm really not. And also from my training. So people are standing around, kids are standing around smoking cigarettes, trying to look cool, feeling really bad inside. They don't really know how to identify it. I remember being that age. I felt bad inside. Someone hands them a Percocet, which was illicitly obtained, and it's magic. It takes away all of their pain. Imagine if you lived in great shame, heartache, and suddenly you have a pill that makes it all go away. They want to reproduce this. Now, I went to school in Philadelphia, and I often relate to people that in 5th grade, some of my fellow students were sniffing glue. What's the difference between glue and opiates? I'll explain that. So as people are taking these opiates, they become tolerant to them, which means they need a consistently higher dose. But nobody expects that to happen. In fact, many physicians don't understand it. Illicit opiates get harder and harder to get, becomes more expensive. By the time they figure that out, they're dependent, which means they're going to have withdrawal symptoms. One of the hard parts for me is that if you walked into an emergency room, I don't think anybody could diagnose you with withdrawal syndrome. It's a constellation of nausea, vomiting, diarrhea, yawning. And before I learned how to do this, a lot I didn't understand. Now, one of the things, so you have somebody who's having withdrawal, and unfortunately, no one will help them. You can all walk into a doctor's office, you can all walk into an emergency room, you really can't go anywhere and talk about this. I saw a woman today, and I was talking to her about this. And she said, she went to her family doctor, and she said, I think I have a problem with these pills. He said, well, you're not taking too many, et cetera, et cetera. Fine. There's other scenarios, we go to an emergency room and say, I have a problem. They're going to say, you're a drug seeker, get out of here. And there's so much bias against these individuals. So what happens? Somebody says, try heroin. It's not a big deal, you'll feel better. And heroin has much more tolerance, much more dependence, and now you're down a really black hole. I'd love to see if there's a way that an individual, I really fault the medical community in a lot of ways, and not for their prescribing, for their prejudice. If you went in somewhere and said you have this problem, they're just going to throw you out, no one will take care of you. What I do, can I talk about some outpatient? We do an outpatient treatment, and it's an alternative to treatment that I'm really not trying to self-promote in any way. I just think there's so many people that don't understand it. I think that's worth talking about. There's a medication called Suboxone, which is buprenorphine, and it has some bad press. A lot of things have bad press. The interesting thing about Suboxone is if I'm called anytime during the day with someone who overdosed last week and is in withdrawal, I'll have them fixed in an hour. I will treat a patient, I'll see them, I'll identify what's going on, we take their whole history. I'm not promoting, I'm just trying to explain the scenario.
Dr. Richmond,
I'm sorry, can I just?
Dr. Richmond, just
I'm sorry.
because we have
I
probably, I'm
apologize. Thank
guessing,
you.
a lot of people that
Thank
want to ask a question. Thank you, sir.
Are there additional questions? Come on.
With the privatization of the penal system, they have to fill their cells in order to make a profit. Has this in any way caused a problem between people who are addicted coming forward and asking for help? Is there a way we can fix that problem of incarcerating people who are minor, have minor offenses?
Let me try to first address that. I think that what you're seeing is a thinking shift there, because what you've said is correct. We really do incarcerate way more people here in the United States than anywhere else in the world. And one of the government here in Pennsylvania gets that, so they passed Act 139, which is the Good Samaritan Law, and it addresses just that issue. And what that does two things. Number one, it made it very easy to get Narcan without a prescription. And number two, it allowed for a person that sees somebody that's in the throes of an overdose to call 911 without any fear of arrest for themselves or the overdoser. And there are just two small exceptions, and that is, requirements, and that is that the person that calls has to cooperate and be truthful. They have to cooperate with law enforcement and be truthful. But as long as that occurs, the person that's suffering from an overdose, even if they possess drugs or drug paraphernalia, they will not be locked up. And that's because our legislature here in Pennsylvania has decided on a policy on a wide-scale basis, it's more important to save a life than to lock somebody up.
Do we need to repeal that privatization?
Well, I can only deal with the sphere that I'm familiar with, and that's here in Bucks County. We do have an issue with prison overcrowding, but I will tell you that it's not often as a result of the initial arrest. It's often as a result of a violation of a parole or probation condition. But it really doesn't have anything to do with privatization here in Bucks County. That might be more of a global issue.
Okay. One of the things I did want to comment about is the youngest person who got caught in the web of addiction that I've ever known was 9 years old.
Thank you. Are there any other questions? Yes.
I grew up in a house of faith. My dad was in law enforcement my entire life. And one of his biggest pet peeves when I was a kid, he used to hate when parents would have little kids and their kids would be doing something wrong and they'd say, oh, you better watch out because the police are going to get you. And that would always be something that always bothered my dad, and he would always say, no, don't do that, because there were situations he was involved in where there were young kids who needed the help of police, and they were trained to be afraid of them. So instead of running to law enforcement for help, they were running away from them in fear. And I appreciate the effort you guys are all making to help inform all of us that you're here to help us, and we all have the same goals, so that we know, to encourage our kids to seek the help instead of to hide from it. And I guess my question to you is, do you see that a lot yourself? Do you find that being a big issue? And then, just to comment also, I graduated from Pennridge, and on a regular basis, like almost every week, I'm reading about someone else who graduated from here who I knew, who's dying of a drug overdose. And so it's a major problem here. So I appreciate all of this. Thank you.
Steve, do you want to get that?
Sure. This is a serious topic, and I find myself tempted to make light because I've been there many times where you go get a call for service, you go to the home, and they say, I want you to talk to my kid and scare the life out of him. And you don't want to say it in front of the child, it's to the parent in front of their child, say, no, you're the parent, you be the parent. Don't have us come in and try to scare your kid, because it does throw that whole dynamic off, and it's something that we're working through. And I know my fellow law enforcement officers in the audience they've all had multiple calls like that, and I'm not trying to make light of it, but it is something real. We are here to help. We're here to help you talk through things. As I said earlier, if we get called into your home, tell us what's going on. We'll talk to you. We'll talk to the kids. We'll take up the illegal items out of the house. They'll be disposed of. Depending on the situation, maybe there will be charges to compel the child to face their addiction, and the courts mandate treatment, and they have to do the treatment. And maybe that's not the best alternative, but a lot of times what happens is once they're forced, they buy into their treatment. And I heard one study, I believe the guy I studied under for my master's, he studied down in Chester Correctional Facility, and in his research he found 25%. You had a group of 100 people who didn't want to quit doing drugs, and the courts forced them to take the treatment. 25 of them bought into their therapy and then went on to truly fight the fight. Sounds a little depressing, but it actually is a marvelously good number. So yes, the police are your friends unless you're doing something illegal. And if it's violent, yeah, we're going to take action. But we are here to help. We want to help you.
I just want to add, as a township supervisor, that's something that's really important to me. I look at the police in my community, Plumstead Township. Every police officer is sort of an ambassador of our board, of our township. And I like when we promote programs like Coffee with a Cop, which we have October 4th at Altamonte's, or Donuts with the DA, or community-oriented policing programs, bike rodeos, things like that. We just had a law enforcement day up in Plumstead it had fantastic attendance, and we have an Explorers Post that helps and participates and recruits youth. It's nice to see, we all have these great school athletic programs, but it's also nice to see kids doing something a little bit different with the Explorers Post or running with a rescue squad. So I feel very strongly in supporting our police. They are there to help, they are there to assist, and for all different reasons, it's more likely that a resident may have an encounter with a police officer. Maybe it is speeding, maybe you hit a deer, maybe there's something suspicious happening in your neighborhood, but they are there to help, they are there to serve, and I feel very strongly as a supervisor that we work with our community to support that. Mr. Lee Rush. the legend is speech.
Oh, that's way too much of a buildup. I really think that it's not necessary, but thank you very much. Thank you, Peter, for your words earlier. My name is Lee Rush, and yeah, I've been around here a long time. I grew up here in Blooming Glen, went to school in high school at Pennridge. I was thinking tonight, one of the things I think we're witnessing is a breakthrough. And there's been many comments about the number of people in the room, which is very gratifying. But I remember a time, well, I graduated in '72, and we used to allow kids to smoke. We had a smoking lounge. It's time to go out and have a cigarette, kids. Have lunch, and we actually go out and have a cigarette as teenagers. So I guess we're getting a little bit more intelligent, a little bit more courageous. But there were times that many years ago we'd come and ask about doing surveys with students and asking kids what's really going on in your life and do it anonymously. And, you know, there's probably some truth about people not wanting to take a hard look at some of the things that are not so pleasant about a place that we live in. And being in a white suburban community where I grew up and still live here, certainly have a lot of gifts. But one of the challenges is this thing called denial, that things aren't, you know, it's not that bad here. Well, I think that it's true. Hearing a lot of people speak tonight, what gets people's attention is death and early lives that are cut short. I'm going to say this name because she's very public. One of the most courageous acts, I don't know if she's here tonight, Jane Straw, but her little daughter, Anna, I knew from the time she was 3 or 4 years old. She'd visit my daughter. They were dance school partners. And when her daughter passed away and that parent chose to write in her obituary that this was due to drug abuse, and she made no bones about making it very public to break through that shame and denial, that was an amazing act. And that person's life, while Anna's not here, her spirit lives on because of her mother and father's courage. So, what I wanted to speak to tonight and get up and just share about this survey. Now, I know Peter's a scientist. I know he probably questions surveys about their validity and reliability. But I want to share one thing, that when we do the survey in Pennridge, we always ask the students 2 questions at the end of the survey. At least we did. I don't know if we're still doing it. Our grant is not currently paying for it, which is great because the Pennridge School District has incurred that cost. That's the purpose of a grant, is to seed ideas and have institutions then take on the responsibility. And thank you very much for continuing the survey, because the survey speaks loudly. We ask every 8th, 10th, and 12th grader what's really going on in your life. Drug use, you know, also positives. What's working in your life? What are your friends like? What are your parents like? What are your home life? What are your extracurriculars like? And at the end of the survey, we ask 2 questions. 1, how honest were you in the survey? Completely, somewhat, not at all. Well, what do you think they say? 90% of them say I'm completely honest. They're honest because it's they're honest. Then we ask them the best question. How honest do you think your friends were? Completely, somewhat, not at all. What do you think they say? 15% think everybody else is honest. So we say that kids do not lie about lying. They're telling us the truth. So I'd like to encourage you to get the results of those surveys, read it, whether you have children here or not. It's a very enlightening report. And one of the things that obviously we know, people mentioned it already, thank you so much, Diane, for highlighting, and others who shared this message, that, yeah, we're here because people do get scared when we hear about opiates and the easy, quick death of what could happen with one use of a heroin or opioids. But tobacco, I want to share some good news. Never in the history of our community has tobacco use been as little as it is right now. Very, very small amount of kids are using tobacco. 2% of 8th graders, 3% of 10th graders, and 14% of seniors. That is down from 30% of seniors when we started this 16 years ago. The most stubborn drugs are still alcohol and marijuana. And in the next 10 to 20 years, we're going to be facing a lot of challenges as the marijuana initiative continues in America. government will look at it as a possible revenue source. There'll be arguments made for and against it. Personally, I don't think it's a good idea to legalize marijuana. Certainly, I think it should be decriminalized. But in this community, 1 out of every 3 seniors is smoking marijuana on a regular basis. It's something to pay attention to. 4 out of every 10 seniors is drinking alcohol on a regular basis. So we got to continue to talk about those 2 drugs. If this night was about alcohol and marijuana, there probably wouldn't be nearly as many people here. But those are the 2 most prevalent drugs that are still being used. So, all right, so I did my teacher part, shared a little education. I wanted to end, I just realized this, well, I know what the day is. Thank you very much for getting up and sharing your story. My mother, who's in Rock Hill, 88 years old, 31 years ago tonight, she got a phone call that our little brother was killed in a car crash. And I just realized that this morning when I woke up and saw in the paper this event was happening tonight, that September 27th, 86, that he was killed in Doylestown, rounding a curve. He only had probably 0.06 alcohol in his blood. It's a couple beers, but it was enough to impair his judgment at 1 a.m. as he rounded a corner that was wet. There's no greater pain to have a life cut short, and whatever you can do, I think every person's hand in this room would go up tonight if I would say how many of you are concerned about somebody right now who's drinking too much or has an alcohol problem. How many of you are concerned about somebody who's smoking pot and they just think it's a fun way to kind of take the edge off at night? So I guess my message is, and I think my brother's spirit still speaks to me, to use any opportunity I can to speak up and talk to people you love, because no one would want to face those kinds of things that many people have. So thank you so much for all of you up here. I think one last comment I want to make is that people like Chief and Superintendent Radigan, as new people come into positions in our community, they need to be told what an excellent job they're doing, because they are. And they're breaking through denial, because in years past, there's been some people in different positions that would not want to break through and say, yes, this is an issue. We've got to have drug take-back boxes in every cop station. We've got to have surveys done every year. Thank you for upping the ratio of counselors and social workers. I still think we need twice as many more. We all do. So let's work on it. And and Stacy, thank you. So thank you very much. Thank you.
Again, I'd like to thank Lee. I'd like to thank Kathy for sharing their stories. I'd like to thank Dr. Yarnell, Dr. Radigan, Dan Radigan, DA Weintraub, Diane Rosati, Executive Director of Bucks County Drug and Alcohol, Chief Hillius, and the other members of law enforcement that are with us tonight. And thank all of you for attending, taking your evening and spending it here with this panel and having this discussion. Thank you. To look for.
If your child or your neighbor is addicted to heroin.
In terms of like what drug paraphernalia looks like?
Symptoms or behavior.
Right. I think we have our genesis for our next program. I think it's something that we'll need to do, whether we do it in partnership with the school, we do it in the community. We did a talk at the Percy Firehouse back in 2013, excuse me, and it was standing room only, and part of that program we did a slideshow that you could see what paraphernalia looks like and the different signs of addiction. So that's something that we'll look for. We'll be looking to do in the next few months and put that together and advertise it out. We'll coordinate with the schools and make it happen.
Just a few, adolescence is a tumultuous time. It's a time of sort of dependence and independence, and kids sort of locking themselves in the room and not knowing if the behavior that you're seeing is a trend, or if it's a mood, or what exactly it is, or if you could even define it. But if, first off, I would say, as a parent, if you have a concern that there is something going on with your child, trust your instinct. You're probably right, there probably is. So don't question yourself too many times before you reach out for help. You are most welcome to call our office. We have some very skilled staff that can just walk you through what to look for. But certainly behavior changes, more seclusion in the room, more than normal, change sometimes in sleeping habits, in eating habits. Of course, finding paraphernalia in the home would be of concern. Not knowing who the friends are, a sudden change in friends, change in grades, much more secretive. They say they're going someplace and you've checked it out and they're not at the place that they say they are. Not being willing to share with you where they're going. So those are just some of the things that we think of that are certainly red flags. It doesn't mean the child necessarily has a substance use disorder, but as a parent, sort of keeping your thumb on what's happening, making sure that you know where they are, when they are, who their friends are is so important. So if you have concerns, any concerns at all, I know the school is most interested in helping parents who have any concerns and helping the students to go through the student assistance program, which of course is free of charge.
One very obvious thing that probably your parents said to you, eye contact. You rarely hear about it today, but when a child has a lot of eye contact with a parent and that changes, they're hiding something.
Sorry, Penn Foundation also has a free community parent education on Sunday afternoons that's open to anyone, where you can come and learn about addiction and family systems.
That's
Jen, what time
great
is that,
information,
Jen?
There's a brochure on the table. Sunday.
So Penn Foundation, Southeast Council, Live and Grin, we're all here. Are your materials still out there for folks who want to get some additional information to take with them? Yes?
Curious what's being sold in our community and what does it look like? What would you find, way before the addiction issue?
Well, as Libra said, the most common drugs still remain alcohol and marijuana. Marijuana typically is in the green leafy vegetable matter form. It looks similar to tobacco. With the way they grow it nowadays, it's much more potent than it ever was. It has a really pungent odor that's unmistakable. Some of this really strong stuff smells a lot like a skunk. It'll have that skunky odor to it. Heroin typically is packaged, typically a white powder. It's packaged in wax paper. As I said before, a lot of it that we see is a blue wax paper that's folded into about a 1/2 or 3/4 inch square, and then those are usually put together in bundles or a bundle of 10 or 15 or 20 packets. Methamphetamines, meth has made a resurgence in our area to some degree. That comes in different looks. A lot of that is like a powder form. Cocaine, again, looks similar. It's usually a white powder. Sometimes it's in the rock form. That's this little pebble of smoke. Crack cocaine is what that's called. And they're mushrooms, LSD. There's all sorts of drugs, unfortunately. But by far the most prominent is alcohol with our kids, alcohol and marijuana. So does that answer? Okay, sure.
Is that it?
Real fast, I'm sorry. Meth is coming back huge, I'm sure you know that, and Adderall is a huge, we need to be aware of Adderall. We didn't even go over that one. That's like methamphetamine, that's really bad for our kids. And meth is coming back huge. So that's what I want to say. Adderall, so all of it.
Chief, if you'd like to recruit any of us for the next panel discussion, I'm sure we'd all say yes, so.
Okay, great.
Thank you. Thank you, Dr. Radigan and Dr. Yarnell for the school this evening.